Do you think understanding temporomandibular disorders is a tough task? If your answer is yes, you should be watching my videos. I am Dr. Sanyukta Shrivastava. I am practicing extensively and successfully in temporomandibular disorders since last many years. So let's get started. What I believe is understanding what is abnormal is not possible without understanding what is normal. So let us understand a normal temporomandibular joint in this video. So all of us know that a normal healthy temporomandibular joint is made up of two bones, the mandibular condyle and the articular fossa. Between these two bony structures is an hourglass shaped structure which is called as the articulate disc. It is made up of dense connective tissue and is devoid of nerves and blood vessels for the most part of it, except extreme peripheries. The disc is interposed in between these two bones in such a way that it sits over the condyle in a 12 o'clock position. The disc has three parts, the posterior thick band, the intermediate zone and the anterior thick band. The disc is designed to take all the functional loads without giving you any pain or inflammation. The disc is attached posteriorly and anteriorly to a number of structures. Posteriorly, it is attached through the superior retrodiscal lamina to the tympanic pate, through the inferior retrodiscal lamina to the posterior margin of the articular surface of the condyle, and in the middle, it is attached posteriorly to the retrodiscal tissues. The disc is attached anteriorly to the infratemporal surface of the greater wing of sphenoid through the articular capsule. It is attached to the anterior margin of the articular surface of the condyle inferiorly, also through the articular capsule. It is attached in the middle anteriorly to the superior lateral pterygoid muscle, also through the capsule. The disc is also attached medially and laterally to the medial and lateral poles of the condyle through the collateral ligaments, specifically the medial collateral ligaments and the lateral collateral ligaments. So I hope you can imagine the disc is attached all around to the margins of the condyle while being free to move over it, and it is also attached posterior-superiorly and antero-superiorly to bony structures. Now this entire assembly is encapsulated in a fibrous capsule that protects it, supports it and contains the synovial fluid. That is so very important to nourish the joint as well as to lubricate the joint. Enough for today. Just remember a few more points. The superior retrodiscal lamina is the only elastic tissue that can pull the disc backwards when it is in its most anterior position. Likewise, the superior lateral pterygoid muscle is the only tissue that can pull the disc in the front when it is in its most posterior position. Rest all the attachments of the disc are ligamentous in nature, which means that they have fixed lengths, they do not stretch, they are not elastic, and once stretched, they do not come back to their original lengths, deranging the joint functions permanently. Another important point to understand is what keeps the disc in its position. Is it the posterior retrodiscal tissue? Is it the muscle, that is the superior lateral pterygoid muscle, or are the ligaments keeping it at its place? The answer is no. It is the disc anatomy and the intra-articular pressure that is keeping the disc over its correct position over the condyle against the articular eminence. And this condyle to disc to fossa relationship is actually what is called as centric relation. I hope you understood the anatomy of a normal temporomandibular joint quite clearly. Keep revising till we get to the temporomandibular disorders in our coming videos. Thank you for watching.